Hi, and welcome back to this second hour of this Thursday edition of Focal Point on AFR Talk. Brian Fisher is my name. If you want to see another reason why the government just ought to get out of the welfare business, just get out of the welfare business, get out of the education business, get out of the healthcare business. We've got this monstrous backlog at the VA, 300,000 claims that have not yet been processed. They've been pending for 125 days or more. This is government-run healthcare. That's what the VA is. It is government-run. It is single-payer. It's a one-stop shop. This is supposed to be paradise on earth if you are of the ilk that socialized medicine is a panacea. VA ought to be exhibit A of how wonderful socialized medicine can be. They got 300,000 claims, 300,000 that have been pending for more than 125 days. Department officials revealed last month that 23 deaths of veterans were linked to delayed cancer screenings going back 4 years. More recently, a retired Dr. Sam Foote alleged that 40 other veterans died because of treatment delays at a VA hospital in Phoenix. So this is 63 veterans that died because service was non-existent, delayed, slow, canceled, or backlogged. And the VA, this is exactly what liberals say is the dream approach to healthcare. Government payer, single payer, one-stop shop. It is a total, absolute, utter disaster. 1.5 million medical orders, 1.5 million medical orders just disappeared. VA just got rid of them. These were orders that had not yet been fulfilled for appointments or for services or whatever. These were orders. I mean, somebody had made a decision, this needs to happen in this medical situation. An order was delivered. They were never completed, and 1.5 million of those were dumped in the trash because the VA was so far behind. They were so backlogged, they just got rid of them. Nobody knows where they went. Nobody knows if these people got the services that they were supposed to get. So, ladies and gentlemen, just get the government out of healthcare. You think the government running healthcare is a good idea? Ask somebody who's been to the VA. It's a total, absolute, utter disaster. One holdover call from last hour. Let's go to Mark in Fort Hood, Texas. Mark, I want to thank you for calling and thank you for waiting. What's on your mind?
Well, listen, I want to say how much I'm speaking on my behalf of the Bible sticks that were distributed. When I was overseas, those boxes went like wildfire. Soldiers grabbed them. I had a set, and the only problem I had is when the batteries died. But if you guys were behind that, God bless you, because when you're deployed, you get lonely, you get depressed. You've got the stress of just the environment you're in.
Yeah.
And, a lot of times the Bibles that you can get, the print is so small, it's easier just to listen than to read. But I also want to say, God bless you folks for standing up just for Judeo-Christian values, and not just that segment of faith, but people of all faith. There's a perception that the military is oppressing individuals, and that perception has been documented. But because of the good efforts you folks have made to stand up, I think the Department of Defense has taken a different look at that. They're beginning to say, hey, look, we don't want to come across as being oppressive. I think people need to realize that we do have a chaplaincy corps, that they wear the Christian cross or whatever faith they're a part of on their chest, and that we are allowed to go to church on Sundays. There are chapels. There is an encouragement, especially in our resiliency programs, to utilize that resource of our chaplaincy corps. And but the bottom line is that's under attack. And if it isn't for an organization, when I say it's under attack, it's under attack by special interest groups opposed to Judeo-Christian values. But if it's not for folks like AFA taking a stand and being our voice, a lot of times we don't have a voice, not one that has a publication or a radio station. We're really just kind of caught, as we say, in the crossfire of this culture war that's emerging. But
Well, listen, I appreciate that very, very much, Mark, and God bless you for your service to our country and your willingness to make considerable sacrifices for the sake of liberty and freedom and our Constitution. Commend you for that, and thank you for your kind words about what AFA does, but we have a really small part to play in this. We love what the military Bible stick people are doing at Faith Comes by Hearing. They're the ones that have created these sticks. They're the ones that are loading them up. They're the ones that send them out. We just think it's a worthwhile project, and you've just verified that, Mark, by saying, look, this means a lot to the soldiers, especially those that are deployed, because that can be pretty lonely duty and stressful duty at times, and so a word from God at a timely time can be a great difference to them. All right, thank you, Mark, very much for that. If you want to follow up with what Mark is saying about these military Bible sticks, again, this is a little unit about the size of a stick of gum. It's remarkably small, very sturdy, matte black, pretty sturdy, made to military specs. They can take it with them wherever they go, so they can listen to it off duty. Some guys fall asleep listening to the Word of God. Just takes one AAA battery to operate for 6 hours. And $25 will get one of these Bible sticks. Mark was talking about it, Fort Hood, Texas, how critical these things are overseas in deployment, how the soldiers just snap them up, can hardly keep them in stock because they mean so much to the soldiers. $25 will underwrite the cost of one of these military Bible sticks, 800-800-2555. That's 800-800-2555, or you can go to militarybiblestick.com. Encourage you to do that right away. And doubling back to this business of healthcare again and this whole single-payer business, ladies and gentlemen, it's an absolute, total, utter, complete disaster. This VA thing is an absolute disaster. You've got this unfolding scandal where folks at the VA were told to falsify records to make it look like veterans were getting appointments and getting their health care needs addressed when they weren't. Here's a story from National Review Online today. Many of the 6,300 veterans treated at the outpatient clinic at Fort Collins, Veterans Affairs Clinic in Fort Collins, waited months to be seen if the clerical staff allowed records to reflect that veterans waited longer than 14 days. They were punished by being placed on a bad boy list. So in other words, what the VA was doing is they were falsifying records to make it look like, because the goal of the VA, a veteran comes in, we want him to get treatment, we want him to be seen in 14 days to 30 days at the outside. Well, they got 6,300 guys that have been waiting for months. And yet the VA records indicated that they had been seen in 14 to 30 days. In other words, when they finally come in, when somebody finally can see them and they come in and get some kind of a treatment, they backdate the request for the clinic visit to the time that they actually showed up. They just run it back 7 to 10 days. Whoa, look at this. They make a request for services, and our records indicate that they got in to see somebody within 7 days. It looks wonderful. It's all bogus. It's totally false. They're lying through their teeth. Just one other dimension that indicates that government-run healthcare, single-payer healthcare, is a total, absolute disaster. We got to repeal Obama, root and branch.
Here's Twyla Brace, president of